Hi, I'm Lissa Klein, part of Progeny's member care team. Welcome to part 1 of our 3-part Progeny member education video on in vitro fertilization, or IVF. In part 1, we will cover everything that you can expect prior to treatment starting. It's important to note that all clinics and all patients are different, so be sure to speak directly with your physician about your protocol if you have any questions. It truly takes a team to properly manage an IVF journey, and the care team you are likely to work with includes 4 key team members. There's the doctor.
My philosophy about taking care of patients is that it is a team approach and a partnership between the patient and the practitioner.
The patient care coordinator, who is sometimes called the patient liaison.
I coordinate the patient's care from the new patient consult all the way until the start of a cycle, any type of cycle that a patient will be doing.
The IVF nurse, and sometimes it's a team of nurses.
Part of my job is working with the coordinator to help organize the patient and make sure they have an idea of expectations.
And the billing specialist, or practice administrator.
From beginning to end, we work with the patient throughout the entire process, from the moment they step in the door until the moment they deliver their child. Even after, if they require any assistance, especially with their insurance, we make sure we advocate for them.
Today we are going to take you through everything you can expect to happen from the moment you decide to pursue IVF until the moment you've reached an outcome. The first thing that usually happens after making that decision is a conversation with your doctor to make sure that you fully understand the risks.
Once the decision has been made to proceed with IVF, patients need to be counseled carefully about all of the risks of IVF. Bleeding from the retrieval, pain from the retrieval, infection from the retrieval. Those are the obvious ones. But the other ones are the side effects of the medications, things like ovarian hyperstimulation syndrome, infection at the site of the injections. So we have to explain all these side effects and what can happen and what can go through. So what I typically do is I sit down with a patient and I say, let's go through the whole process. We start with an orientation to IVF, some pictures, egg and sperm meeting in the laboratory and whatnot. But then we also go through the consent forms, explaining that each step of the process has its own inherent risks and making sure the patient understands those risks. You see, consent forms everyone thinks are just to protect us in case we get sued. But actually, consents have a really important purpose in the IVF process. Consents are the opportunity for a patient to take what is being told to them and now read it on a piece of paper. A good clinic has consent forms for patients ahead of time that they can take home and read. A great clinic, in my opinion, is a clinic that engages patients on their consent forms and says to them, do you have any questions about what you're about to sign? Not just hoping they sign their forms to move on to the next process.
After gaining a complete understanding of all of the side effects and risks of the IVF process, one of the first and most important conversations that needs to happen with your doctor is a conversation about your specific protocol.
The patient and the partner, if there is one present, and the physician should sit down all together to make a plan. And what we do is we typically look at a patient's height and weight, that gives us their body mass index, their anti-Mullerian hormone, which is a blood marker of how good their ovarian reserve is or what their egg count should be, the ultrasound that we performed upon the patient where we counted their eggs on day 2 or 3 of their cycle, that's the baseline scan, the baseline hormones, which we typically assess on day 2 or 3 of their menstrual cycle, to help us understand that is the brain yelling at the ovary every month, or is the brain and the ovary communicating beautifully? And then, of course, the patient's age. Once we have all these data points, we can figure out what medications the patient has to take to stimulate their ovaries to grow a robust number of follicles in a safe manner. The hormones that we give patients are follicle-stimulating hormone, or FSH, and luteinizing hormone, or LH. In the United States, we cannot give LH to a patient alone, so LH and FSH come together as one single drug. That drug is known as Menopur. But the follicle-stimulating hormone can come to the patient in 2 different forms. One's called Follistim and one's called Gono-F. Regardless of the manufacturer, they all have the same function. And the function is turning the gas on to grow eggs. In our practice at CCRM, and most other practices around the country, are not fans of blasting away with hormones. And when you explain this to patients, that's actually their biggest fear. Everyone's afraid that they're going to be blasted with hormones and blasted with drugs. So what we believe is that we give patients an appropriate amount of medications to encourage a safe number of follicles that develop, that hopefully have good quality, where the follicles are around the same size.
In vitro fertilization protocols are customized on a patient-to-patient basis, and one of the first things that needs to be customized is the timing and preparation for when you will start your medication.
Sometimes we tell a patient, call us with day 1 of your cycle when you start bleeding, and we'll start you with medication on day 2 or 3. Sometimes we say to patients, you know what, we need to regulate you because maybe you don't get periods, or maybe you're a super responder, we need to suppress you, so we're going to use the birth control pill. Or maybe you live afar and we have to schedule a trip for you to come into our clinic. So in that case, we can give you the birth control pill for a couple days or a couple weeks or a couple months. And typically you stop the pill and then 2 days later you start these drugs. Sometimes we have to have patients down-regulate that brain yelling at the ovary. Right? That brain is so used to yelling at the ovary, kind of like your mom yelling at you to clean up your room when you're a child, that your mom can't use a normal talking tone with you. And so to help calm down your body's system, we use an estrogen patch or estrogen pills, right? Because the feedback mechanism to the brain is estrogen. And so if the brain sees that there's estrogen on board, it'll calm down its own FSH. So sometimes we have patients take the patch or the pill, and then they come in on day 2 or 3 of their cycle when they start bleeding.
After you and your doctor set the protocol, the rest of the team starts to get to work to help you prepare for the treatment. This part is often spearheaded by the patient care coordinator.
A lot of things happen the month before. It's not like you just come in and say, I'm ready to start and let's just do this. We always like to work with the period beforehand to get all of the logistics done, all of the medications ordered, all the finances in order, and then we go from there. We discuss the timeline of an IVF cycle and just make sure that the patient is comfortable with how that's going to work and if they have any traveling schedules, because a lot of people come in here and they actually have blackout dates is what we call it. So what it would look like is we actually go in there with a physical calendar and we write down every step of the way, everything that they need to have scheduled, by what time they need to have their documents in. We also put down a week in which they are allotted to have a nurse consult prior to injection start. We just like to explain to the patient, this is how it works. Is the timing seem right for you? This is what the doctor has planned for you.
If you're watching this video, there's a good chance that you are covered by Progyny. When you get to the clinic, you should make it clear to the patient care coordinator and to your physician that you have Progyny coverage. You should also communicate with your patient care advocate before you begin treatment. It makes a big difference from the very beginning.
So the difference for me with Progyny patients is it just seems a lot easier. I feel like they have a sense of they're already okay when they come in here.
An important part of the process prior to treatment beginning is a conversation with a billing specialist to go over the overall cost, authorizations, and general financial expectations. One thing that is important for Progyny members to understand is that your coverage is subject to any copayment, coinsurance, deductible, or out-of-pocket maximum associated with your primary health plan. You can go over these details with your patient care advocate.
In terms of finances, there are 3 different scenarios. There's a self-pay patient, no insurance coverage, and Progyny. So with the self-pay patient, they're 100% out of pocket. Their typical cost is roughly about $30,000, and that consists of the IVF with the testing and the medications and your anesthesia. And we break that process down for them, right? So we tell them this is your cycle, this is where you pay it, this is your medications, this is where it goes, and the anesthesia. No one seems to think about the anesthesia, and that's a huge aspect. The insurance aspect, we still give them the self-pay price and what the estimated reimbursement could be for their insurance and the timeline of when that reimbursement can come into play. For example, a patient can pay on November 29th, but the insurance company typically has 45 days to pay the patient. And so we set that expectation for them so they know when to get the process started.
With traditional coverage, there are a lot of roadblocks and mandates that get in the way. One of the standard roadblocks, if you don't have Progyny, is a policy called lesser before greater.
Most insurance companies consist of lesser before greater. So basically what they look for is to ensure that the patient is in fact infertile and if any less invasive procedures can be performed before IVF. But if a patient comes to us and we know that she needs IVF, we automatically put it in for them and we say this is what we recommend. Insurance companies comes back and says, why don't you try to do this procedure before this procedure?
The back and forth requires that both you and the clinic have to struggle with the insurance company, and it doesn't always result in coverage for IVF, often leaving patients to pay out of pocket for the treatment they need or deciding to begin with lesser treatments that are not likely to succeed, wasting money and precious time. With Progyny, this is never an issue.
When a patient comes to our practice and they have Progyny, the process is amazing. They're already set up with their patient care advocates, so they have everything aligned from their authorizations, their IDs, exactly what's covered, what's not covered, and actually what their smart cycles look like. So they know everything. We just go over it with them, so we set that expectation, but the process is seamless.
A crucial piece of the IVF puzzle is the authorizations for the medications that you will be taking for the 10 to 12 days of stimulation.
So the medication process, especially for authorization, is very specific. They require the type of medication, is it name brand or non-name brand, and the dosaging. So for example, if a patient's 33 years old and on a high dosage, they may question why she's on that dosage. So same requirements, they want all your medical records, they want to confirm why you're doing the treatment, and then they tell you exactly where to fill the medications. So a patient may come in and think, oh, I can just go to my local 20-year CVS. It actually has to be a specialty pharmacy within the city or a mail order depending on your insurance.
If you have your medication covered through Progyny RX, again, the process is much more streamlined.
So Progyny RX is pretty similar to their authorization process. It's seamless. They tell us exactly where to fill the medications. They ask for the authorization for what's been approved, and we just submit everything to them.
An important step of any IVF protocol is the IVF orientation, which is usually run by an IVF nurse.
So we usually schedule the nurse consult, which is a patient orientation, when everything has been completed in terms of prerequisite checklists. So their infectious disease panel, genetics, major things that would help determine what their protocol was for moving forward with the IVF process. So once all that is complete, we would schedule the orientation class or nurse consult, where they meet with a nurse and we sit down to talk about IVF in general. So we start off with a slideshow, which usually entails the normal menses cycle and what we do during a stimulated cycle, because I think that is important to start with the basics. And we talk about that medication and how it's used, potential side effects, etc. We also talk about how to use the medication. It's very overwhelming as a patient when you get a box of medication, so we try to break that down as best as possible and give as much education as we can. So we give step-by-step instructions, we give access to videos online. I know myself, I sit down with the patient and actually show them what they're going to be using, because I prefer a hands-on approach. I think it's good to just touch everything and see what you're going to be working with. So when that night comes, when you have to start your first injection, you're not as intimidated. So medication teaching is probably one of the biggest parts of the nurse consult, but then also talking about their specific protocol. So we talk about their cycle, how their protocol works with their cycle, how it works with their calendar. You know, we're always getting questions about timeline and they're going on vacation and how this affects their treatment. So that's definitely something we would review at that point as well.
IVF medications are usually self-administered injections that you do at home. Some of the medications are very straightforward, some are a little more complex, and many patients feel anxiety about this part of the process. The doctors and nurses at your clinic are important resources for you to lean on, but don't forget that you can also rely on Progyny and on our patient care advocates to help you ease the burden. If you have Progyny RX, you can schedule an unpacket consult with every shipment of medications you receive. On that call, you will speak with a pharmacist or nurse who will walk you through all your medications, how to store and administer the drugs, and answer any questions that you may have. After your IVF orientation, there is one more important step before you can begin the stimulation process: the suppression check, sometimes called your baseline morning monitoring visit.
So once you're set up for your cycle, we usually tell you a specific day to come in for your suppression check. So your suppression check entails blood work and ultrasound to make sure you are suppressed. We want your follicles to be all very, very small. We want your lining to be nice and thin, and we want your estrogen to be low, your progesterone to be negative, your LH, everything to be nice and low prior to starting the medication, because we know that this is the best way your body will actually respond to the medication. We do this suppression check also to make sure you don't have any dominant follicles. Should you have a dominant follicle, the medication wouldn't work. So that is essentially what the suppression check is. Probably the most important check to begin with. So you come in, you meet with the front desk, you tell them you're here. The medical assistant then pulls you back to draw your blood work, and then you meet with the doctor who will do your ultrasound. That first day, you also meet with a nurse to again go over what to expect. So she'll say, if everything looks good today, we'll send you your instructions via the patient portal or call if that's what we've set up for you.
This has been part 1 of our 3-part education video on the IVF experience. In part 2, we will take you through everything you can expect during the stimulation and monitoring process through the day you go in for the egg retrieval. Please don't hesitate to reach out directly to your patient care advocate if you have any questions or concerns about your upcoming treatment. And remember, you can always get more information at progeny.com/education. I'm Lissa Klein, and on behalf of your entire Progeny family, we look forward to helping you along your journey.